Good evening all. Today our class is about femoral artery. Our class is about femoral artery. Do subscribe our channel, follow the classes as well as go through the Instagram for notes. Okay, you are now coming to the class. Today our class is about femoral artery. One of the important question for 5 marks for university exams, as well as it is included in 15 marks also. And along with this femoral artery, we will discuss about one of the branch of this femoral artery, that is Profunda femoris artery. Profunda femoris artery. Okay, yeah. Now coming to the class. And the femoral artery is the chiefest artery in the lower limb. It is the chief artery in the lower limb. Next. And its origin, coming to the origin of this artery, see, it is the continuation of external iliac artery. It is the continuation of external iliac artery, and it begins behind the inguinal ligament. If it is the inguinal ligament, it begins, that means femoral artery begins behind the inguinal artery at the mid inguinal point, like this, at the point of where, at the base of the femoral triangle. Next, coming to the extent and course of this femoral artery. See, the extent and course of the femoral artery. The femoral artery passes downwards. If it is the femoral artery, the femoral artery passes downwards and medially. Okay, it is the medial and it is the lateral. It passes downwards and medially and first in the femoral triangle. Think that it is the femoral triangle. It enters into the femoral triangle at the medial side. Okay, and then into the adductor canal. It comes down through the adductor canal. Next, at the lower end of the adductor canal, and at the if it is the adductor canal, at the lower end of the adductor canal, that means here, that means at the junction of middle and lower 1/3, middle and lower 1/3 of the thigh. That means I will explain clearly. If it is the knee joint, think that it is the knee joint. The adductor canal is placed at here. That means at middle and lower 2/3 of this. Lower third of this thigh. Okay, next, it passes through an opening in the. That means from the adductor lower end of the adductor canal, it passes through an opening into the adductor magnus. Think that it is the adductor magnus. Here it is the adductor magnus, and from the adductor magnus it continues as popliteal artery. Okay, its extent and course I will repeat again. See, it comes from the inguinal ligament and into the femoral triangle, and then into the adductor canal, and then into the adductor magnus, and continues as popliteal artery. Yes. Next, coming to the relations of this femoral artery. That means at the anterior side, at the anterior there we will see skin, superficial fascia, deep fascia, and anterior wall of femoral sheath. Superficial fascia, deep fascia, skin, anterior wall of femoral sheath. And next, coming to the posterior surface. At the posterior surface we can see psoas major muscle. At the posterior surface we can see psoas major muscle, pectineus muscle, and adductor longus muscle. Next, at the medial side we can see femoral vein. And at the lateral side we can see femoral nerve. These are the relations of this femoral artery. Next, coming to the branches of this femoral artery, there are 6 branches in the femoral artery. There are 6 branches, and 3 from superficial branches and 3 are deep branches. 3 are superficial, 3 are deep branches. Here is the superficial branches. First one is superficial external pudendal branch. Superficial external pudendal artery. These artery supplies to the skin of external genital organs. Next, superficial epigastric artery. branch superficial epigastric artery. This supplies to the skin and the fascia of lower parts of anterior abdominal wall. That means it supplies to the anterior abdominal wall of skin and fascia of lower parts. Next, third one is superficial circumflex iliac artery. Superficial circumflex iliac artery. It supplies to the skin along the iliac crest. These three branches supplies to the skin. These superficial external pudendal supplies to the skin of external genital organs. This superficial epigastric supplies to the skin of lower abdomen region, that means anterior side, and this one, that means superficial circumflex iliac artery, supplies to the skin of iliac crest. Next, coming to the deep branches, here is the superficial branches and here is the deep branches. Now coming to the deep branches, the first one is profunda femoris. Profunda femoris. It is one of the important branch in this femoral artery. Next one is deep external pudendal supplies. Deep external pudendal artery. Deep external pudendal artery. This artery supplies to the external genital organs. That means scrotum, etc., etc., clitoris, like that. Next, third one is muscular branch. Third one is muscular branch. These are the three branches that these are the three deep branches that supplies to this femoral artery. Next, coming to the point, next these are the branches that we have completed in the femoral artery. Next, one of the important branches of femoral artery is profunda femoris artery. Okay, we will discuss about this artery, and it is the largest branch of this entire femoral artery, and it is the chief artery of supply. That means it is the chief artery that supplies to all the three compartments of thigh. That means an anterior compartment, posterior compartment, as well as medial compartment. Anterior compartment, posterior compartment, as well as medial compartment. It supplies to all the three compartments of the thigh. Okay. Next, now coming to the origin and course of this profunda femoris artery, and here it that means it arises from the lateral side of femoral artery. If it is the femoral artery, it arises from the it is the lateral side and it is medial side. It arises from the lateral side of the femoral artery. It arises from the lateral side of the femoral artery. Next, its origin lies in front of iliacus. That means here where the point that means where the branch arises from the femoral artery, here is the point that it is having iliacus muscle. Okay, iliacus muscle. That means iliacus muscle unde place lo if profunda femoris artery anedi ఆ బ్రాంచ్ అనేది డివైడ్ అవుతుంది. దట్ మీన్స్ ఆ బ్రాంచ్ అనేది అరైజ్ అవుతుంది ఫ్రమ్ femoral artery. నెక్స్ట్, దిస్ artery descends, see like this artery descends and it passes posterior to femoral vessels. It descends and passes posterior to femoral vessels. It leaves the femoral triangle by passing deep to adductor longus. Here, if it is the femoral triangle, here we can see the adductor longus, adductor canal. That means adductor longus. It leaves the femoral triangle by passing deep to adductor longus muscle. Next, it continues as downwards and it passes first between adductor longus as well as between adductor brevis. Next, its terminal part pairs as, that means simply its terminal part pairs as adductor magnus. Okay, it pairs, that means it is the terminal part of this profunda femoris artery. It pairs as the adductor magnus muscle. It pairs as the adductor magnus muscle to form anastomosis with upper muscular branch of popliteal artery. That means at the adductor magnus, this profunda femoris artery forms anastomosis. It forms anastomosis with the muscular branch. And again, this profunda femoris artery branch, that means the branch of this femoral artery, it again divides into 6 branches. It again divides into 6 branches. Okay, one is lateral circumflex femoral artery. That means here is the lateral side. So first one is lateral circumflex femoral artery. Next one is medial circumflex femoral artery. And next 3 are perforating arteries. Okay, next 3 are perforating arteries. First one is lateral circumflex femoral artery. Next one is medial circumflex femoral artery. Next 3 are perforating artery, and it itself ends as 4th perforating artery. It itself ends as, that means danantata adi chivariki 4th perforating artery ga end ayipotadi. So from here these profunda femoris artery is ended, and it continues as popliteal artery. Okay, next these are the branches of this profunda femoral artery. Now we will discuss about each branch. That means medial circumflex femoral artery. It leaves the triangle, that means femoral triangle, by passing posterior between, that means this medial circumflex femoral artery leaves femoral triangle by passing posteriorly between pectineus muscle and psoas major muscle. Pectineus muscle and psoas major muscle. This lateral circumflex femoral artery runs laterally between anterior and posterior divisions of femoral nerve, and it passes behind sartorius muscle, rectus femoris, and it passes, this lateral circumflex femoral artery passes behind sartorius and rectus femoris, and again it divides into 3 sub branches. First one is ascending branch. Next one is transverse branch. Next one is descending branch. Ascending branch, transverse branch, and descending branch. Next, this ascending branch runs deep to tensor fasciolata, and it gives branches to, that means this ascending branch supplies to hip joint, and greater trochanter of femur. This one supplies, that means this ascending branch supplies to hip joint and the greater trochanter of femoris, and it forms anastomosis with superior gluteal artery, and it also forms anastomosis with superior gluteal artery. Next, this transverse branch pairs as the vastus lateralis, that means it comes out through this vastus lateralis and takes part in cruciate anastomosis. That means this transverse branch also forms anastomosis on the back of the thigh just below greater trochanter. Next, it forms anastomosis just below greater trochanter, and this descending branch runs downwards along the anterior border of vastus lateralis, and this one it comes accompanied by nerve of that muscle. That means this descending branch accompanies with the nerve of this muscle. Okay, this is all about the profunda femoris artery and femoral artery. These together important for 5 marks as well as for 15 marks. Thank you all.